A private medical jet ferrying Dr. Kent Brantley from Liberia landed at Dobbins Air Reserve Base in Marietta, Georgia on Saturday. Brantley was the only patient on the plane. The other infected aid worker, Nancy Wrightbull, is still in Africa and is expected to arrive here within the next few days. Inside the plane, Brantley was kept in an isolation tent to prevent him from infecting the medical workers who traveled with him. The 33-year-old physician from Texas was then transported by ambulance to Emory University Hospital 20 miles away. Brantley, dressed in protective clothing, walked into the facility with help from a paramedic. He's now being treated in an isolation unit. That unit was built in collaboration with the CDC, which is just down the street. The agency uses that facility to treat workers who've been exposed to highly infectious diseases. Dr. Jay Varkey is an infectious disease specialist at Emory University Hospital. Do you worry when you go in and treat a patient that has a disease like Ebola?
I don't. I truly believe in the practices we have in place, and I have no specific concerns either for my personal safety or for my colleagues.
The CDC says the chance of Ebola spreading to the medical personnel treating Brantley or the general public is highly unlikely. That's because it is difficult to transmit, according to Dr. John LaPook, chief medical correspondent for CBS News.
It's only spread through direct contact with body fluids. And specifically, it is not spread through the air. If somebody coughs and you're down the row from them in an airplane, you're not going to get infected.
Doctors say Brantley's chances of survival at Emory are much higher than they would be in West Africa.
They have become infected through...
Dr. Bruce Ribner will help treat Brantley.
We can deliver a substantially higher level of care and a substantially higher level of support to optimize the likelihood that those patients will survive this episode.
There are no known cures or vaccines for the virus, which is estimated to kill 60 to 80% of the people it infects. The CDC says the only way to fight the disease for now is to stop it at its source.
Policy Unit 2.
The agency's Emergency Operations Center is tracking Ebola cases in Africa and helping organizations like Doctors Without Borders figure out how to keep it from spreading.
I'm Debora Patta in South Africa. Sierra Leone and Liberia have lived through brutal conflicts. Now they face a disease more terrifying than war, one that has claimed more than 700 lives and infected over 1,300 people across 4 West African countries. Following a top-level meeting with the heads of state in Guinea's capital, Conakry, the World Health Organization sounded a grim warning. Ebola is spiraling out of control, and the results could be catastrophic. But the Director General of the World Health Organization, Margaret Chan, believes the disease can still be halted.
Ebola outbreaks, when managed properly, when the correct information for the citizens, they come forward as early as possible for treatment, Ebola can be stopped. And people can regain their livelihood.
On the front lines of the battle to contain Ebola, it is fear of the disease that is causing more harm than the disease itself.
People are terrified to go for treatment, believing that an isolation ward is an effective death sentence. Even a person coughing in a crowded public space is viewed with suspicion, and foreign doctors are being blamed for bringing Ebola to Africa rather than trying to treat it.
Emergency measures have been put in place in Sierra Leone and Liberia. Soldiers are going door to door trying to track down infected patients and urge them to seek treatment. But it is not enough, and the World Health Organization has appealed to the international community to send teams of medical experts and other life-saving resources to the countries hardest hit by the worst Ebola outbreak in history.